Korea is adopting a new treatment system amid a frightening rebound in daily infections. For more on the local efforts and those elsewhere to tackle Omicron, I have Professor Yu Byung-uk from Soonchunang University. Professor Yu, it's a pleasure to see you again. I also have Professor Sarah Shin at Korea University live on the line. It's been a while, Professor Shin. Welcome back.
Thank you for having me.
Right, Professor Yu, we'll start here. Now, if a COVID-19 patient is asymptomatic or has mild symptoms, would it be acceptable to treat the infection, Omicron, like the flu?
Well, Omicron variant is very similar like a seasonal flu, but we have to watching about it. Like 30 to 50 is a young, healthy guy who are infected, also less than 18 years old. They can treat it as like observed at home, and closely contacted government monitoring line will be safe. But my concern is a third space. Third space means for the doctors, blind spot, vulnerable peoples, and who are single residents, and who are high age. So that's why cannot be accessed to contact the government line. It can be happen something, even the Omicron variants, because you know that before 2019, seasonal flu make the victim around 3,000 to 7,000 approximately that once in a year. So many people make their lives finished with the influenza. So some people are treated at home with a doctor's prescription like a Tamiflu. Yeah, they'll recover well, but someone who not. That's why we have to make the next step should be a private transport should be allowed. The person who are stayed at home, treated at home the treatment, who are getting worse, and before we move the code in the contact in the government line, government will be distributed hospital, and private transport is allowed to deliver the hospital will be good. But if you not establish like this, so it can be the confused people or vulnerable groups.
Right, and keeping in mind the concerns raised by Professor Yu, Professor Shin, where does Korea's new treatment strategy that places priority on the elderly leave those who are relatively young but in need of medical assistance?
Well, obviously, with the record high number for confirmed cases, and we're expecting a rapid surge in infection cases for upcoming months, it's inevitable that the government decided to, take the strategies to focus on treating just the vulnerable, the priority group, such as the elderly. But we must not forget that, the government has left out the important vulnerable groups, such as younger people with chronic underlying conditions and people with physical or mental difficulties who cannot take care of themselves. So we must not forget that these people are also at higher risk of transmitting the virus and developing severe symptoms than the general public do. So the government should really include these groups into the categories where the intensive management group with the elderly, so that they can get the access to treatment kits as well as the daily health checks. So that way, I think we can minimize any infection risk for those individuals who are vulnerable.
Right. And Professor Yu, for COVID-19 patients younger than 50 who are not eligible for Paxlovid, what over-the-counter medication do you recommend?
Well, actually, where I'm working in the hospital, we keep on the line the patient who are we have to take care of them before the yesterday. So governments delivered some medication like acetaminophen, we can call the Tylenol or paracetamol, and other kind of pain reliever. Yes, we deliver. It's like the general management, but from today, probably it's not probably delivered on time to the patient who need at home. So from now on, we have to preparing some home remedy like acetaminophen, we can call paracetamol or Tylenol, and ibuprofen for the pain reliever or the fever controller. And sometimes we are thoroughly tickling and aching. We need a goggle to prevent it, and some other release for the coughing. First of all, contact your home doctors, family physician first, to ask them to the prescription for preparing, or your home, the pharmacies, you can, the pharmacists on town, you can access to consult them to preparing for the next step will be fine. So which means paracetamol and the general medication will help, but antibiotics, antiviral agent, you should contact the specialists or the doctors because it needs a prescription.
Right, I see. And now, while Korea's treatment strategy has been altered, its social distancing efforts remain in place. But this is not the case over in Germany, where officials are witnessing record infections but seeking to ease related restrictions. For more on the situation there, I have Dr. Claudia Denkinger at the University Hospital Heidelberg. Dr. Denkinger, it's a pleasure to speak with you again.
Thank you very much for having me again.
Right, Doctor, let's begin with a few words on the resurgence over in Germany driven by Omicron then.
So yes, so we have really skyrocketing numbers here, about 1,500 7-day average in terms of everyday cases. That being said, in comparison to other peak numbers that we have seen in other European countries over the last weeks and months, we are still far away from reaching such peaks. And we do expect that over the coming weeks, modeling suggests in the next week or two, I think it will be a little later because we had a slower rise, we will be reaching our peak. And I do expect it to be lower than it was at the peak in France or Denmark or the UK. But we are having skyrocketing numbers right now, yes.
Right. And despite that reality, Dr. Denkinger, I understand that several German states are looking to lift restrictions. What are your personal thoughts on these efforts?
I mean, on the one hand, we have these very high numbers. On the other hand, we also do have hospitals that are not overloaded at this stage in most parts of the country. So we are not facing the same reality that we had at the peak of the Delta wave. So in combining, on the one hand, the low hospitalization rates with Omicron, as you see also in Korea, and on the other hand, the high numbers, we do think that we can ease restrictions, and that's what many states are actually doing now.
Right. And Dr. Denkinger, what has been the public response to these efforts to ease restrictions?
So generally, the public has been asking to ease restrictions because they also perceive the Omicron variant as less dangerous and see that the less people around them get sick. And right now, I know we have in the hospital over 200 staff that is in quarantine. And hardly anyone has any symptoms. So we also have to face the reality that we have to keep our system going, and with that ease measures so that we can get closer to a normality again.
Right. Meanwhile, back here in the country, Professor Shin, some are calling for the lifting of vaccine pass requirements at drinking and dining establishments. How do you respond?
So yeah, right now Omicron is sort of beyond our capacity to handle. We have to face the fact that we can no longer control the outbreak. All we can do now is to really limit the damage. That's why the government decided to take the hands-off contact tracing strategies. So it's questionable how effective the quarantine pass at the cafe or restaurants will be, since we are not doing the contact tracing anymore. I understand that the rationale for the rapid shift to the Omicron response plan by the government is that Omicron is less threatening than the Delta in terms of mortality and morbidity. But if we keep seeing record high numbers of confirmed cases, we'll also see higher numbers of severe cases in coming months as well. So I think the government should be more consistent with the quarantine rules and give general public and local clinics step-by-step guidelines or protocols in terms of what to do when you get infected, so that we really can minimize the infection risk and the damage that is caused by the Omicron outbreak.
Right. And moving forward, Professor Yu, authorities here are also framing out a plan to roll out a second booster dose for the elderly at nursing homes. What do you believe needs to be the gist of this particular campaign?
Well, I love this word, second booster shot, not fourth one, because the people are registered of the number. who are waiting for like a 251 shot for the next couple of years, they are resisting about it. But the second booster shot could be necessary for the person. We have to be choose very carefully. Yeah, I believe that Germany as well and Korea, we have to preparing our own data, which is very useful or not. So we have to do the research, people, the unknowns, the people who need the second booster one. Why? Because the Korean government, we are preparing for after the 4 months from the first booster one. So which means probably first booster one done around the November, December. So we face on the second booster one will be start from the March and April. But the problem is we still have the classics messenger RNA vaccination and others as well for the classic COVID-19 virus, no Omicron variant. Fortunately, so the Pfizer CEO and Moderna CEO, they announced will be released soon of the new vaccines against these Omicron variants. So we can planning to give them for the second booster one. Probably they make me understand more easy and less resistant. Now Korea's current situation is around the 50% complete the first booster one. So among the 50% of the first booster one, how many percent who necessary the second booster one? Let's choose very carefully and show them to this efficiency and safety, and we listen from their opinion. So if we push them to the shot, even push, they will keep away from us.
Right. Staying with COVID-19 vaccination, Dr. Deng Kinga, what can you tell us about the vaccination process over in Germany?
Yeah, so I'm impressed by the Korean rates in terms of vaccination. Unfortunately, we haven't been so successful in, I would say, normalizing the vaccination for people. And we have about 25% of the population and still about 10% in the over age 60 that are not vaccinated. And this is the main concern in respect to the rising numbers right now, because these are the vulnerable populations who are at high risk of getting severe disease. And these are the ones we need to be reaching, but we don't seem to be able to reach them. I think it's in part because of the way the public communication has been initiated around the vaccine. I think there have been opportunities missed. And also, I think in part it's the populations who have a migrant background in Germany who are not well reached. And I observe that especially in my own practice, where I see a large population of people who have migration background and might not be as comfortable with the German language, with the German system. And there have been missed opportunities. And that's what's biting us right now in respect to easing measures, because these are the people who end up, unfortunately, in the hospital.
Right. And staying in Germany, Dr. Deng Kinga, I understand that Germany has granted the green light to Novavax recently. What can you tell us about the efficacy of Novavax? And perhaps do you see this particular vaccine as perhaps boosting the vaccination rate over in Germany?
Yes, I mean, the Novavax vaccine certainly has advantages in terms of building on a known mechanism of vaccination. And with the mRNA vaccines, people had the concern about this new mechanism and potential side effects or consequences from it. Although scientifically speaking, I think not substantiated concerns. That being said, it's always better to have something that has been used before, and with that, Novavax certainly can convince more people. In terms of its efficacy, I mean, we have seen very good data that makes it coming close, and I would say, in light of the comparability of the studies, probably as effective as the other vaccines. And we do hope that this will create another booster, but I am skeptical, frankly, because I think the problem is not so much in the scientific understanding of the vaccine, but in the communication and reaching the people we have thus far not reached.
You're right, which really is an unfortunate reality. But staying with Novavax, Professor Shin. Now, Novavax's vaccine will be available to adults here in the country starting later this month in Korea. How does Novavax's vaccine compare to that of Pfizer and Moderna? And do you believe it will perhaps further raise Korea's vaccination rate?
Well, so Novavax vaccine uses more conventional approach than the vaccine that we are already approved and given, like mRNA vaccines or viral vector vaccines. So their platforms are totally different. They're protein-based vaccines, and they use tiny particles studied with viral proteins, usually mixed with immune-boosting compounds like adjuvants. So using this conventional method has been well accepted in the world as other successful vaccines in the past. So this could make the vaccine more attractive to people who are hesitant to be inoculated with vaccines, like those with the Pfizer or Moderna that uses the new technology like mRNA technology. So, so far, the clinical data suggests that the Novavax vaccine was found to be protective against the Delta variants that we had before. The company recently announced that it can generate an immune response against the Omicron variants, but this has not been peer-reviewed or published officially. So it remains to be seen how strong and how robust the protection will be against the Omicron outbreak.
Right. And Professor Yu, what are the prospects of using Novavax as a booster dose, like Professor Shin mentioned, especially for those who suffered from side effects after vaccination with an mRNA vaccine?
Well, we're still looking for the medical evidence to the link from the messenger RNA type of vaccines make the myocarditis, kind of heart issues. Yes, but you know what? People say it's not related much, but actually there are persons who are suffer after the vaccination. Yes, there are. Anyway, people are worried about it. So messenger RNA type like Moderna and Pfizer one can make some heart issues and some lymphadenitis, swollen limbs, and the angular axillary area can be. So, but you know what? The many medical experts comment already. Novavax type is totally different, made it also long history about it. So, but usually we recommend for like if you started from Pfizer, better to keep and finish the Pfizer one. But so nowadays, if you have some bad experience before with some other type of vaccination, yes, better to switch. But Korean governments still now we recommend from the beginning who are never vaccinated yet. Let's start with the Novavax one from the first. But if you who had bad experience before, yes, we highly recommend to cross vaccination in cross brands from the Pfizer, Moderna, to the Novavax. Yes, can be, but Korean government highly consider, but not permit yet. But I hope they will permit soon.
Right. And Dr. Denkinga, what now is your assessment perhaps of the current global spread of COVID-19? And do you believe Omicron is paving the path to an endemic scenario of this particular pandemic?
Yeah, thank you for this question. I think we can only talk about the end of the pandemic if we really have offered everybody in the world an opportunity to get vaccinated. And we are far away from that. I think in Korea and Germany, we're in a luxurious situation. But I do think that the Omicron variant has shown us that we cannot vaccinate our way out of this pandemic. We can protect people with the vaccines from severe disease. And we will have more variants coming. And I think we have to get used to COVID-19 being with us, similar to like influenza is with us in an endemic state with changed variants that are coming every year. That being said, I think if we do not have so much SARS-CoV-2 circulating in the world globally, we can also expect that the virus is going to evolve more slowly so that we have less of immune escape in future variants to come. So I think COVID-19 will stay with us. I think we have a vaccine and we need to offer it to everybody in the world in order to protect people and then live with it.
Right, a valid point there. Professor Shin, back here in the country, there are changes in our treatment strategy, and amid those changes, what do you believe is of utmost importance in the case of infection now?
Well, so if you test positive, although you don't have any symptoms or you have mild symptoms, you still have to be self-isolated for 7 days. And you basically have to take care of yourself at home. So if your symptoms get worse and develop high fever or chest discomfort, then you must contact your healthcare providers for the advice, and you need to get the help. And it is important to monitor the daily conditions as well. And it'll be wise to have medications like Tylenol at home. And most importantly, you need to drink a lot of water, stay hydrated, and take a good rest, just like what you would do when you have cold symptoms.
All right, Professor Shin, as always, thank you very much for your insights. And Professor Dan Kinga over in Germany, thank you very much for being with us earlier at this hour. And Professor Yu here in the studio, as always, thank you very much for your insights.